One.
Hi, I'm Dr. Sharyl Truty, owner of Balanced Physician Care here in Ponte Vedra, Florida. And we're here today to talk a little bit about the coronavirus for our patients and for our community. I'm joined today by my nurse practitioner, Arlene Aquino. So our practice is, again, based in Ponte Vedra, Florida. And if you have any questions regarding today's Facebook Live, please check out our website at balancedphysiciancare.com or give us a call at 904-930-4774. So we're here today to talk a little bit about the coronavirus. Obviously, it is a hot topic of conversation. So we really wanted to get together and talk to our patients in the community from a physician's perspective and a patient-physician perspective. What is the coronavirus and what do you need to know for yourself and your family? I know we hear a lot of things on the news and the news media, and it's scary. So we're here to kind of hopefully do what physicians and nurse practitioners and providers do best, and that's help you understand what's going on and what you can do for you and your family. So what exactly is the coronavirus? This virus that is going around has obviously been called coronavirus, or it's called COVID-19. And it's basically an upper respiratory virus, something similar to the flu, something similar to a cold. It has some similarity to SARS that you may have heard of in the past. And so it is a basic upper respiratory virus. What are the symptoms? Well, for a lot of people, the symptoms of coronavirus are actually very mild. They look a lot like a regular cold. Typically symptoms, fever, 83 to 90% of people who have had this have had a fever, cough, and shortness of breath. So those are probably the three main symptoms that we're keying in on. So cough, again, about 40 to 80% of people have had that, and only 31% of people have had real shortness of breath when they contracted this virus, the cases that are known. So all of our data today is coming from the CDC, as well as the Florida Department of Health and the AAFP, or American Academy of Family Physicians website. Some other symptoms besides fever, cough, and shortness of breath: runny nose, sore throat, bronchitis-like symptoms, pneumonia. So, I mean, bottom line right, Arlene? I mean, this sounds like a cold. You know, if you're out in the community, this is what goes around at this time of year. So I think that that's what's making everybody scared and really concerned. Really the people who need to worry, are people who may have weakened immune systems. Only 15 to 20% of cases have become severe. And I think what they mean by severe are people who developed significant pneumonia or needed to go into the hospital with significant symptoms. Again, the demographic of people who seem to get this tend to be 40 and older. So we're really not seeing this in the pediatric population. So I want to reassure pregnant women, women with infants, and mothers that are nursing. So far, we have not seen this in those types of patients. For most of us, the only other, I think, main thing to note about the symptoms as we're beginning to understand this virus is that, again, you have what seems to be a very common type of upper respiratory symptoms: cough, maybe some shortness of breath, maybe some fever, sore throat. That what tends to happen with this virus is that it lingers, and it lingers beyond a week. And what we're seeing is that the severe symptoms seem to begin to occur after you've had these symptoms going on for about a week. So the severe symptoms seem to be occurring on day 8 or more. So certainly if you are having a long, protracted cold-like symptom, this would be something to alert yourself. So, right now the populations, that we're seeing that we're suspicious for coronavirus are people who have had direct contact with people who have had the coronavirus, and people who have traveled. So the main travel concerns are China, Iran, Italy, Japan, and South Korea. So that's what the CDC says, that there are major activity of the virus. So anybody who's traveled from any of those countries, there's a need to be concerned. We typically see symptoms 14 days from the onset. So if you traveled within the past 14 days, if you've come back from any of those countries back here into the United States, you sort of have a 14-day window if you start to develop any of these symptoms that we're going to be concerned about it. If it's been 28 days, really at that point, there's not a concern. It's probably another type of a cold. So, and then obviously in conjunction with the travel history and with the onset of symptoms within 14 days, if you have any of the concerning symptoms, which are fever, shortness of breath, or cough, that's when you want to contact your provider. So, how is this spread? Everybody has, concern, about this virus because it is a virus. And as we try to give our patients good education, there is not antibiotics for viruses, right? So, we really, prevention is sort of the best way. And so there's obviously a lot of concern and a lot of panic about, okay, how do I prevent myself and my family from, getting this virus? So we're going to talk a little bit about that. Arlene's kind of prepared something to talk a little bit about that in a few seconds. So as we talked about, okay, what is coronavirus? What are the symptoms and who needs to be concerned? Obviously, there's the question of what's going on here in Florida, and do we need to be concerned here in Florida? So as of this morning, the State of Florida Health Department did report that there are now 2 cases of the coronavirus here in Florida. They're considered to be presumptively positive, meaning that we're still awaiting word from final confirmation from the CDC as to whether they're positive. There are 8 tests that are pending, and I want to let people know there are also 15 tests that are negative. So not everybody who's being tested for this is coming back positive, but in the Tampa area, it's been reported that there are 2 cases that are positive. So, what types of treatment, are available? Again, because it's a virus, if you develop any symptoms, we're really just going to assess you and see how you are doing, and then decide, what the best course of action is. So if you're exposed to the coronavirus, if you recently traveled, come back and have any of those things are positive, I would recommend that you contact your primary care physician or your main healthcare provider first before heading into an office, because there are certain protocols that if you let the provider know ahead of time, that we're able to put in place to protect anyone who might be around or in that office. So here at our office, if you're a patient at our practice, Balanced Physician Care, If you have any concern, I would ask you first to just give us a call, and we will schedule a telephone visit with you and then decide what's going on and what's best to do. Because if your symptoms are mild, we may have the directions from the CDC are to stay home and to be recover at home. And I'll talk a little bit more about that in a bit. Or to obviously go, if your symptoms are more significant, to the hospital. Because at the hospital and emergency room, if you're having severe shortness of breath and you feel very weak and very tired, they're going to have the supportive care that's going to be able to take care of you. So as we talked about, an ounce of prevention is worth a pound of cure. So Arlene, tell me a little bit, there's a lot of confusion about what can I do as an individual to prevent me or my family getting this, and what things can we do?
Like Dr. Truty said, my name's Arlene Aquino. I'm a nurse practitioner here. According to the CDC website, they say prevention is mostly due back to hand washing, and you can use either regular soap or you can use antibacterial soap. There's no difference, just soap and water. Wash your hands for 20 seconds, and they recommend either singing a song, like saying your ABCs, or singing Row, Row, Row Your Boat. That is supposed to be 20 seconds long. And if you
That's the hardest thing, is that making sure you're actually washing your hands for 15, 20 seconds.
And then they say if you, the CDC also recommends that the soap and water is not available, that you can use the hand sanitizers that are around. Those are an alternative to soap and water. And if you're out and about, I know Publix has them. I know Target, Walmart has them. You can use any of the sanitizer cloths to wipe down the carts or table where you're at if you're eating out at a restaurant. And anytime if you shake somebody's hand, just make sure you keep a pocket of hand sanitizer in your hand and to keep them clean.
Because, because respiratory, what this is a cold or flu that gets spread via respiratory droplets. And so the biggest thing for most of us is not so much that someone's going to cough right in our face, It's more that someone is going to cough or wipe their nose and rub a surface, and then we touch that surface, and then we touch our mouth, our nose, or our eyes. That's the droplet. So what we do to protect, the best protection, and this is why, the different CDC and Surgeon General keep saying that the best thing to do is to wash your hands, is because the more you wipe those viruses off your hands and you kill them, the less likely you're to touch your mouth, your nose, or your eyes. We all have a tendency as human beings to touch those things. We don't even realize that we're tired. We put our, hands here, or, we have an itch on our nose and we scratch it there. And so that's what really enables, the spread. So the more we're washing our hands and the more that we're using these kinds of things. So heck, for most of us that are moms, we carry this stuff around anyway all the time for our kids. So, I just make sure that everybody's got these, or you can buy the wipes that you just tear off and you can put in your pocket. And, and then don't be afraid to wipe down surfaces. I know it kind of seems like, it may be a little bit of overkill, but, heck, if you're at a restaurant, I know they're wiping the tables, but, I wouldn't feel bad about wiping stuff down when you're out and about in the community. I think those are sort of the best things. I know people have mentioned face masks. What's your take on the face mask thing, Arlene?
The CDC recommends that if you're healthy, that you really don't need one to prevent, and if you're sick, then they want you to try to isolate yourself, and you can wear one at that point to try to prevent spreading
Yeah.
any of your droplets around.
Yeah. So, if you're getting sick and you're starting to come down with something and maybe you're not really sure, then that's the time to use a mask so that you prevent the spread to other people. But us walking around with masks probably in the end is not going to be, that helpful unless you're going into, unless you're a caretaker. So if a family member of yours may be getting sick or may be suspicious for getting the coronavirus, then at that point, because the contact is so close, that's where it might make sense. So again, I want to just emphasize that for right now, that the symptoms of the coronavirus are very similar to any other upper respiratory infection, and that only a small percentage of cases are becoming severe. And if you have any suspicion that you have the virus, then I would recommend, again, contacting your physician's office first, or emergency room, or maybe even local urgent care. And again, suspicions that you have it is one, close contact with anyone who's been tested positive. Just like, with the flu, if your kids have the flu, you know that you are at risk for having it. The second thing is travel to any of the 5 countries sort of on the list. And again, those 5 countries right now are China, Iran, Italy, Japan, and South Korea. And that if you traveled from those countries and you're now back here, if you develop symptoms within 14 days, anything outside of 14 days, we really don't feel that there's any more of a concern. And so if you have any suspicion, again, I would, come in or contact your provider, or walk in and tell the front staff immediately, because then what we want to do at our office is we're going to take you back and put you back into a room, and then the physician will assess you. And so right now, when you go into a doctor's office, if you've been tested positive, the plan that most of us in the outpatient setting are putting into practice is that we'll isolate you into a room, and then one of the staff will come in and they'll have appropriate universal precautions, a gown, a glove, mask, and assess your respiratory status. Again, that's a pulse ox machine, making sure your oxygenation is good. Listen to your lungs, make sure that's good. Listen to your heart and lungs, and make sure that you look stable. And if you are looking stable and feeling okay, the treatment plan really is to go home and isolate yourself. And that's the plan if you have good caretakers that are at home. So if you're stable and otherwise just kind of a little bit sick, and you have a good caregiver at home that can help you, manage, watch you, obviously do grocery shopping so that you can stay home, and you need to have a separate bedroom in your home where you can stay isolated. And then we provide that caretaker, gloves, masks, and stuff like that to be able to take care of you. And, most likely this is just going to run its course like a cold. If you were to get worse, then you would go to the hospital, where obviously then they would take care of you in the hospital setting, monitor your vitals, and take care of you. So again, this is a virus. Most likely for most people, if you do happen to get it, it's going to run its natural course. So, one thing that I always like to tell people is that to remember about this virus is that a virus is only going to settle into your body if the host or the person themselves is weakened. So it's not only about how virulent the virus is, but it's also how you yourself are feeling and feeling good. So I would really encourage people to, make sure that you're doing all the right things to keep yourself and your immune system as strong as possible. And that means eating healthy, making sure you're getting plenty of fruits and vegetables, making sure you're getting a little bit of exercise. Exercise a little bit boosts the immune system and really gets it going. Too much exercise actually dampens it. So, if you're running a marathon, you have to decide that maybe if you're feeling kind of sick, that is not a good idea. But every day walking, biking, exercise actually boosts the immune system. And then there's several herbals or supplements that really can be helpful. Vitamin C is one of them. So I recommend people are taking, about 1,000 milligrams of vitamin C, especially if you're concerned you're getting sick. Zinc is another one, a lot of people don't like the taste of them,
Right.
but that is a good thing that's been shown to help. So I make sure that I have those in my medicine cabinet. The other thing we have here is we have a package of a bunch of other herbs that have really been shown to be very powerful against viruses. One of the main ones in here is elderberry, which is also available, in other products over the counter. So I would recommend having some elderberry syrup. Echinacea and astragalus are also in here. So I like this one and sell this one particularly at our office for our patients, and these are available for us. They'll be here by the end of the week. But regardless of whether you get them here, again, those herbs are elderberry, astragalus, and echinacea that have been shown to be helpful and supportive to the immune system, besides, vitamin C and zinc. Vitamin D also is another vitamin that we also want to make sure that we have enough of, and that's helpful for the immune system. So the other thing is making sure your allergies are under control. If your allergies are not under control, your immune system is going to be trying to fight off the allergies. And I think particularly here in Florida, this time of year can be tough for people who have allergies. So if you have allergies or suspect you do, make sure you're taking something for those allergies, whether that's something over the counter like Zyrtec, Claritin, or Allegra, or Nasacort or Flonase. Those are all things that are available over the counter that can kind of help you keep allergies under control. Another more natural thing is doing a sinus rinse, and that's also been shown to be very helpful and very effective. So if you have questions on that, please contact me or Arlene, and we'd be happy to talk to you about that, or contact your provider, if you are struggling with allergies and you kind of want to do that.
Dr. Truty, I just wanted to mention for the immune system, rest, getting plenty of sleep.
Yes.
It also helps your immune system, so at least try to get 6 hours of sleep. I know that people are busy,
Right.
but that will help boost your
Yeah.
immune system.
Excellent point. It's on my list, and I agree. I mean, I think making sure you're getting enough sleep is huge. And doing some stuff to try to reduce your stress. I mean, we all live stressful lives, but, but trying, if you're not feeling so good, maybe to do a few less things on your to-do list. Like you said, sleep is very important. Absolutely, absolutely. Anything else that you would say, what you put on your list for, trying to boost the immune system that we sometimes forget?
I always believe in diet with lots of fruits and vegetables. You can't eat enough of them
Yes.
to build up your immune system if you're not into like taking any medications or vitamins.
Yeah.
That's a great way. You can never eat too many fruits and vegetables.
No, and especially the citrus fruits, right? Those are really high in vitamin C, and they're going to really be supportive to the immune system. The other thing that I like to tell patients is get a thermometer at home. There are just so many people you and I talk to who, they don't have a thermometer at home. And really, as a physician, if you're calling me and I'm trying to decide what to do for you, knowing your temperature really is going to help us, figure out what's going on. So get a thermometer. It doesn't have to be anything fancy, just a regular thermometer. And the other thing is, if you have family members that might be older and have some respiratory conditions, you can buy pulse ox. It's over the counter, the little thing that you put your finger on to tell you about how much oxygen. It's not as great as some of the stuff that they have in the hospital, but you can buy that and buy a cheap stethoscope. I mean, you can buy something that's really not that expensive, just so that you can listen. Because if, the guidelines are that if you're sick and we want to try to keep you at home, having those tools to monitor what's going on is really, really going to be helpful. So again, I don't know if there's anything else that you'd like to add with that, Arlene. So, just to summarize, the key points about everything that we've talked about today is, yes, there are some cases here in Florida now, and we'll continue to update you as we hear new things from the Florida Department of Health. So I'd encourage you to please check your emails from any emails from us for those of you that are members, and please check our website as we'll continue to try to help keep you updated of sources of information. I'm sure the media, news media will do that as well. There are 2 cases here in Florida. And remember, this is an upper respiratory infection that's very similar to a lot of other respiratory infections. And there's only a small percentage of cases that seem to cause severe symptoms. So for most people, if you don't have any other significant other health issues, it's just going to feel like a cold. Again, there's only a couple cases, so again, paying attention to exposure is going to be a very important question for us. So if you've traveled to any of the 4 countries, China, Iran, Italy, Japan, or South Korea, and you develop symptoms within 14 days, or you've been exposed to someone with the coronavirus, if you've been contacted by the health department, please let your provider know. And if you come down with symptoms and you've traveled, yes, please reach out right away to your provider so that we know what is going on. And do those things that Arlene talked about, good, just general cold and flu things to keep yourself protected. Try as much as you can to teach your kids to cough into, their shirt or at least into their elbow. Wash your hands as often as you can. Use antibacterial soap, wipe down surfaces, and keep your immune system strong. Get plenty of sleep, eat healthy, exercise, and maybe consider some of the herbals that we talked about. So I think that kind of gives us a summary and hopefully gives you some real hard-nosed practical tips on what to do. Again, we will keep you updated as new things arise. So thank you very much for joining us here today. Again, I'm here with Arlene Aquino, my nurse practitioner. My name is Dr. Sharyl Truty, and we work here at my practice, Balanced Physician Care in Ponte Vedra Beach. Our website is balanced with a D, physiciancare.com. So we'll post this Facebook Live presentation on our website if you want to look through it again or refer any of your friends or family members to read through it. Our phone number is 904-930-4774. That's 904-437-4774. And to any of our patients, again, should you have any concerns, please just send me an email, send us an email, or give us a call, and we'll be happy to talk you through it if any symptoms you start having that you're concerned about. Thank you very much for joining us here today, and have a good afternoon.